country music icon Kenny Rogers died. We understand he passed away yesterday. He was 81. I want to bring in our foreign editor, Sophie Mokoena, now to talk about this and other issues. Sophie, a huge loss. Kenny Rogers, world-renowned. I mean, the music fraternity won't be the same.
I think it's a great loss to the country music. We know that Kenny Rogers is loved by many, and his music is quite a good one, and we know that many people relate to what he's saying in his messages, but and those people, his generation, a great loss indeed, but also to young people who are familiar with music based on what their parents are playing at home. You know that sometimes, even though you are not in favor of that particular genre, but because your parents have been playing that music, you get used to it. And I think it's a great loss, but legacy will continue. Music, there's no way.
It doesn't die.
It doesn't die. It will not.
He was 81. Do we know the cause of death?
It's not clear yet, but apparently it's a natural death, and also he was living at the hospice, and therefore, 81, quite old. Yes.
We're going to try and get more information with regards to the death of the late, great Kenny Rogers as the program goes on. I want to bring you in to talk about the other big issue, pandemic, coronavirus, scary words, people are afraid, anxiety. It seems as every day we're reaching a new tragic milestone, as put by the WHO director. Where are we at this stage, especially in Africa?
Well, we see countries continuing to report cases, and we see new countries joining in. You know that yesterday in the evening we heard that there was a case reported from Zimbabwe. It was at Vic Falls, but there are now rumors that midday we are going to have the Minister of Health in Zimbabwe making an announcement, and there are fears that more numbers are going to be reported, particularly in Harare. We saw earlier on social media the leader of the MDC, Nelson Chamisa, talking about what he heard from the health authorities in Harare, and it looks like SADC now is really having this problem.
Because it seemed to us that President Mnangagwa tried to get ahead of this. He put in measures even before they had their first reported case.
He did, but all countries have done that. But the question is, will Zimbabwe be able to handle this crisis? Looking at their infrastructure, looking at the challenges that they have, looking at issues such as the economy, are they going to be able to deal with this? You know that for months we've seen the health sector collapsing in that country. We saw doctors on strike. We don't know whether right now the health sector is back on its feet, and also the doctors, all of them are back and working. They are going to be overwhelmed should there be a bigger problem.
What about test kits? We know that the WHO has said that they distribute about 1.5 million tests to about 120 countries. Jack Ma of Alibaba has stepped up as well, helping out in various regions. What do we know in terms of Africa? Do we have adequate testing facilities?
We don't have adequate. I mean, the worldwide, we don't have adequate testing kits. We know very well that even in America, they are currently working hard to get supplies. And we know that China has promised to assist countries, and they are doing that. We know that they are currently helping Italy. But also on the continent, as you have indicated, Jack Ma sending lots of stuff, but also Ali Dangote from Nigeria also assisting, putting aside money and assisting the continent. The Disease Control Center in Ethiopia raising concerns around the capacity and also whether other countries are ready. The World Health Organization, the Sub-Sahara region, they are really, really worried whether all countries are at the position where they'll be able to handle numbers. When you look at what's happening in Italy, it's quite scary. You must have enough capacity to deal with this crisis if it hits your country. And South Africa is currently working hard. It's a race against time to ensure that we are having all what we need to deal with this problem.
it's so interesting the way this virus is moving. Italy has now become the new epicenter with regards to COVID-19. China, things are improving. Hubei province, Wuhan, reported, I think it was the second day of no new cases. And I guess it talks to this positive news that this crisis can be managed at both at a clinical level as well as a public policy level.
Yes, public policy. For China, it was easy when you look at the issue of government there, how it's conducting its business as a socialist country. You know, when President Jinping issue instructions, no one is going to defy him. When he says it's a quarantine, it's a quarantine. If he says it's isolation, it's isolation. If he says it's a lockdown, it's lockdown.
Yeah.
All citizens in China respect whatever the head of state is issuing as directives. And therefore, it was easy perhaps for China to clamp down. For example, in Wuhan, when they took a decision to build hospitals, it happened immediately. And deadlines were met and everything was done with precision, almost like the military system. But in other countries where you have democracies, people may resist and they have rights. You have to navigate, you have to consult. We saw President Ramaphosa meeting different groupings to ensure that everybody is on board. But you still have people who are defiant. Now the law must kick in because government has gazetted those measures and therefore you can take action. I mean, we saw one pastor saying Ramaphosa is not God, I'm going to do this and that, not realizing that we live in a different time, at the time where these measures are gazetted and are currently, you can enforce that, it's law. And therefore, that is why the Minister Begitele emphasized the fact that they are going to arrest people. I mean, if you defy, if you break the law, you'll be arrested. And I don't think people would like to see that happening. Now, Italy also, you have a situation where it's almost like a free country, you know, people moving around and some not really respecting orders. And that is why we find this situation. And also you look at the population.
At the initial stage. Now it's locked down.
Now it's locked down. Now it's locked down. But people didn't take precautionary measures that were announced by state or by health authorities. That is why in South Africa, we must ensure that people understand what they are supposed to do as responsible citizens. Let's make, for an example, in studio like this. Normally, you'll be not far from me. Today, I've taken another...
That's social distancing.
Yes, social distancing. Work must be done, but there are measures that we have taken as a broadcaster to ensure that we comply, but also we do our part to educate, but also to ensure that you continue to bring people information.
Yeah, I just want to talk a bit more about Italy and what went wrong. You know, what are people saying? You know, I have visited Italy before, and what stands out, and reportedly this is the case, is that Italy has, you know, a lot of people are very healthy there, so which means that their life expectancy is much longer. You have a lot of older people there, the nonnas, as they call, the grannies, as they call. Could that be a contributing factor where you see over 4,000 deaths?
While we have been warned by the World Health Organization that we shouldn't really emphasize the fact that this disease or this virus is targeting or it's more deadly to elderly people, many young people did test positive, and some of them are in hospitals as we speak, and some have lost lives. So we have to be careful. But the reality is for elderly people, because their immune system is already compromised, and you know that they have chronic diseases and they have challenges of health, it becomes even more difficult for them to really stand this, because the body on its own has to fight this disease. And therefore, that is why you have a very senior population in Italy, like in China. And maybe that could be another contributing factor. But really, it's a question of really listening to scientists, listening to doctors, and really taking those measures seriously.
I would say science needs to lead, especially at this time. And to your point with regards to the younger people, although the older population is the hardest hit, the WHO yesterday was saying that data from many countries see that puts people under the age of 50. They make up a large proportion of people that need hospitalization. So it's not just the older folk that, need to be concerned in this regard. The WHO was saying solidarity is key in fighting the spread of COVID-19. Are you getting a sense from world leaders especially? Okay, let's talk about Trump, Donald Trump, US president, calling this a Chinese virus. What does that do in terms of the messaging around COVID-19?
It's sad when leaders continue to fight their own petty country battles at a critical time like this. You know, there has been tension between the United States of America and China based on the trade war between the two countries. Now, it looks like President Trump is continuing and now using this epidemic. It's unfortunate because as we speak, much as the outbreak was in China, it's not clear what caused this and how did it happen. That is why people are now asking questions around Italy. Why this trend in Italy? Therefore, for now, scientists are in the labs. They are trying to make sense of this pandemic, but also solutions. And therefore, we must leave everything to them because they are better placed to tell us why this and what this kind of a challenge, how we should approach it and what it should be called. And I think it plays to the mindset of ordinary people in those respective countries where you'll continue to see the stigma, you'll continue to see xenophobia as it has happened in Ethiopia.
We got to go, Sophie, but very, very briefly, with regards to the lessons that we can learn, especially from countries like South Korea as well, you know, what they had to deal with and how it relates to the new cases that are springing up in the Free State. What can you tell us about that?
Well, you'd recall that what led to South Korea having a problem, somebody traveled to China to attend a church gathering, a private matter, and then the person went to church. And that's how this whole virus was spread in South Korea. Now we have a similar problem in the Free State, where there was a church gathering a few days ago before the measures were gazetted, and you had 200 people converging, attending a church conference. They came from different parts of South Africa, but also outside South Africa, you know. And 5 people later in that province have been tested positive. And some of those people were in that church. Now they have interacted with more than 200 people. So we don't know on the issue of contact what has happened. And that is why the Minister of Health went to Free State to try and get information on the ground, but also lead and direct the process to do testing, but also tracking people who were in that gathering. And you know, by now, those people have gone to different communities or institutions. Therefore, it is a huge, huge problem.
Sophie, appreciate your time and insight. Thank you very much indeed.
Thank you.
All right, our foreign editor there, Sophie Mokoena.